Hello everyone, my name is Summer Ray, and today I'm going to be presenting on Asian American children, specifically counseling with them. So most of you know this about me, hence my classroom. I actually teach Asian American children online, specifically children in China. And I thought it would be funny to do my presentation in my classroom. So I was really excited when I got to do Asian American children just because I already have some knowledge on them, but I was also excited to gain more about them. Um, okay, so let me share my screen with you. All right, hopefully this is working. Okay. Um, So saving face is a huge thing in the Asian American culture. And they say face culture. They actually pronounce it mienza, and it's a huge thing. They all know about it. So saving face or face culture includes like perfectionism within the family and not embarrassing your family members. And so this is common for all Asian American families to set high standards and expectations that are actually not always attainable. So I had a personal experience, or not a personal experience, but a student tell me about a situation where this happened. She says that she's really bad at math. And she was out with her parents one time and she heard them over talking about education and things like that, and she heard her mom say, oh well, Cindy is really good at math. And she's sitting there like, what? No, I'm not. I'm really bad at math, Mom. Why would you say that? And she was really young at the time, and she understood later on that that was like, saving face, face culture, not to embarrass her family because she was bad at math. Um, and something that's also different, in China, at least I know, is that the students don't raise their hand in class to ask questions. They listen to the teacher. Now, they can answer questions if the teacher asks them to, but if they have a question, excuse me, they go up to the professor or teacher after class to ask. And that's part of their saving face because it's maybe embarrassing to ask a silly question in class, whereas in the US, it's like everybody asks questions. So the two major components of that is the high standards that they have, but then also a perceived discrepancy between the standards the family has set for their behavior and importance. And so a child might be actually doing really well. But since the standards in their family or in their school or where the city they live in are so high, it might just not look good enough to the family. So they're doing really well, but they can't meet that high expectation. And then shame is really big. So it's actually related to depressive symptoms and family perfectionism, feeling negatively about one's whole self within their family system. And I'll get into that later, but family systems are huge in Asian American culture. And then it is linked to mental health issues. Ethnic belongingness is also really big for Asian Americans who have a greater sense of belongingness to their ethnic group, may actually endorse more psychological outcomes like depression, anxiety, and stress. So I thought that was interesting. You would think that people that are close knit and all that with their families would not experience more depression, anxiety, and stress, but well, it's not letting me. Okay. So racialization in schools. I know that as a kid that I think that I did not ever specifically see Asian Americans being racialized, but now that I think back about it and I'm learning about it, I agree that it is an issue. So they do commonly experience it in schools. The school system actually takes part in it and is not only between their peers. So they have this thing called the model minority stereotype for Asian Americans. And we think, oh, they're so intelligent all the time. Us Americans can't live up to their standards. They're so smart. And they have these educators in the US, without thinking, have these things that, oh, they're such model students. They have high academic success, and they're so intelligent. And it puts a lot of stress actually on these students. And so that's kind of where that comes from. Um, and they it may seem as though they're not experiencing that's like, oh, that's a good thing that you're smart and intelligent, but at the same time they might not feel that on the inside, and so they feel like, oh, I have to live up to these expectations that I actually might not be able to do. Okay, so here's a study, social anxiety and mental health among Asian American high school students, in 2015, so it was pretty recent. So this study aimed to see whether Asian American students would report higher levels of social anxiety than other ethnic groups, and whether it would affect them academically. So it was especially true for Asian American females that reported the highest levels of social anxiety, and they scored in the clinical range more frequently than other ethnic groups. So it is also due to expectations from their families. The social anxiety is their pressure to succeed and do well. Discrimination from peers is also a possible factor because of frequent results of it being found for Asian Americans. And it could also be related to discomfort in academic situations, and also communication. So later on, I'll get into this, but there's a difference for children who have U.S. born parents and children who have immigrant parents. So they might be born in the U.S., but their parents weren't. And so there's a lot of the times there's a huge communication gap in there. And so they might not do as well academically here, just for many reasons like that. Okay, so disparities in healthcare quality among Asian American children with special healthcare needs. So this study looked at how Asian American parents and families feel about the healthcare that their child is receiving here in the U.S. So Asian American parents were less likely than white parents to report good things, basically. So Asian parents reported less good things about the healthcare in America. They believed that their healthcare provider did not provide them with specific information that they needed in regards to their child's health. They did not feel like they were helped efficiently they didn't feel like they were a partner in their child's care, and that they weren't able to work one-on-one with the provider. And they also did not feel that the provider was sensitive to the family's values and customs. And this is a big issue. You know, a lot of these studies that I'm looking at, they're all done by Asian Americans. And it's kind of sad because it seems as though they're the only ones researching and trying to find out how Americans can be better and help them. And then there are other possibilities in regards to the parents' thoughts on the abilities of the clinician, just because they don't know that they can accurately help their child. And you know, in different countries, different cultures, they have different medical practice beliefs. And so it kind of makes sense why Americans would feel like they were getting good healthcare in America, just because they likely have the same beliefs. But Asian Americans are very culturally sensitive, I guess you could say, and they do things their way specifically, and I don't know that they're always open to new strategies when they know that like certain things work. So more on the healthcare. Oh, no, this is the same. I think so. Yes, it is. Okay. Cultural adaptation. We'll talk about this later too. It is super important. parenting and child mental health among English-speaking Asian American immigrant families. The research, it says this is limited. This study says it's limited. I found some good research, I think at least, that we'll talk about later on, but this study feels like it is limited, and I don't disagree. So children of Asian immigrants are at greater risk for poor mental health and interpersonal relationships compared to children of U.S.-born parents. So whether they are Asian or not. So children of Asian immigrants have a higher risk of mental health problems than Asian children with parents that were born in the U.S. or any other American whose parents were born in the U.S. Cultural adaptation is related to parenting beliefs and practices. Acculturation is the adaptation of the mainstream culture. Enculturation is the maintenance of a culture of origin. So acculturation is like receiving and being open to the new culture of the country that you are now living in. Enculturation is, no, I'm sticking to what I know. My culture is end all be all. And so it really differs. We'll talk about that later, but it really differs for all families. They sometimes have a little bit, sometimes not. So here's the the 4 categories of cultural adaptation. Assimilation is the first one. So this is low participation in your own culture and high participation in the new culture. So this is parents that move to, Asian American parents that move to the U.S. Or any ethnic background. They decide that they're going to participate highly in this new culture and take it on and roll with it and, start fresh, I guess, and kind of leave behind the things that they used to believe. Separation is the low participation in new culture and high participation in their own culture. So, they come to a new country, but they don't want to adapt to or take on the things of this culture. They want to keep believing what they've always believed, what they've been preached. And I think that this is more common than assimilation, just because of how collectivist they are. But I'll get into that later. Okay, so marginalization is low participation in own culture and low participation in new culture. I don't really understand anyone that would specifically be this way. I mean, I get it, but if you're not adapting to your old culture or the new one, it's like, what do you believe? I don't know, but it has to be a category. So, and then integration and biculturalism. I think this is the most popular for many reasons. So it's high participation in the new culture and high participation in your own culture. And I think it depends on how old the parents are, how whether they're immigrants or they were U.S. born. Just because other countries like China, all these kids online that I teach, they want to learn English so bad because that's the language of the world or whatever it may be. And so I think you guys are getting these notifications on my phone and I don't know how to, okay, airplane mode. Maybe that will work. Anyway, so I lost my train of thought. Oh, so they all want to learn English. And they want to participate in the American culture. It's important to them and their families, and their parents want them to have a really good education and be able to maybe come to America one day because we're the land of the free, right? And so they, want their children to participate highly in these other cultures, but at the same time, they care a lot about their own culture as well and keeping their roots, which is understandable. Okay, so more on cultural adaptations and its effect on parenting and early childhood mental health. So this is another thing that some studies said some different things. I have my own opinions about it, but we'll get into it. So biculturalism, which is the high participation in both, has suggested to be the best adaptation to promote immigrant well-being, but it is not well studied or understood amongst this population. I think that the population of Asian Americans in America is growing, so maybe we can get more research done on this in the future. But I wonder, how much are they willing to say that they're accepting of a new culture and of keeping their own? I'm not sure. Findings from studies are inconsistent in that some studies show that higher levels of acculturation is related to authoritative parents, more engaged parents, and less harsh parenting. This was shown to have been associated with lower levels of child behavior problems. And then other studies find no association between the parental enculturation, and parenting. So who knows? But I do agree that parents who are willing to acculturate, if that's the word I'm looking for, are going to leave their child with higher opportunities, especially when you place them in a country where that is the culture. I think that it is likely to help them if you're more accepting of it. Okay, and the findings suggest an interplay between culture, parenting, and child factors, which is everything in life. There's an interplay between culture, parenting, child factors, everything. There's always an interplay, your biology, nurture, nature, all that. Early childhood interventions that strengthen positive parenting practices hold evidence towards promoting effective mental health among young Asian American children and families. Some of those interventions include improving emotional socialization and reducing harsh and inconsistent responses to misbehavior. So this makes me think of some of the little bitty kids that I do teach online. It's crazy because I have 3 and 4-year-olds in front of my screen learning English, and some of them can speak pretty well and some of them not so much. But some have parents that sit right behind them during class, and they will slap them or hit them upside the head or whatever it is, literally hit them with a ruler if they say a word wrong or if they pronounce it wrong. And it's really hard for me over here because I'm like, oh, they're learning, they're so young. But then there's those parents who literally could care less. They just want to know that their child is trying and learning. So I think it's different with everybody, just in like every culture. Okay, so clinical assessment and intervention with Asian American adolescents. Clinical work with Asian American adolescents often involves their parents as well. Actually, it says often, I think always. We know this. Parents are so important in the mental health process and, making sure that psychological issues or anything in life is dealt with for children. And having unsupportive parents is not going to be helpful, especially when you're learning a new culture in a new country. Contact with these parents can range from in-depth involvement in treatment and direct family intervention to limited periodic phone contact. So it's actually not, well, you probably know this, but a lot of Asian Americans don't go to counselors. And so it's kind of taboo to them. And maybe if a child is sent from their school, the parent might not be as involved because, they didn't take them there themselves. They might not think that their kid has the issue. So categories of family assessment include composition and subsystems. these can be variable. So it's like, who is in the family, who lives in the home, who doesn't live in the home that is necessary to the situation and the members, and things like that. And then there's role relationships. So what is the child's role in the family? In China, or I guess anywhere, it could traditionally be based on their sex, and their birth order. So, you know, it's important to know these things when dealing with these children. And then there's patterns of communication. So in other cultures, women might not be able to speak up in the way that men can. And sex and age govern the degree of expression, and that is allowed, the expression that's allowed, and the initiator of the conversation, or the structure of language used, and the topics being addressed. So these are all things that are needed to be taken into consideration, because we don't know, when you're working with a family like this, what things are allowed to be communicated, and you don't want to ask the wrong questions. And then socioeconomic status, always, we know what that means. Moving on. Okay, finding common ground. This is huge. For parents to even engage in the intervention process is huge. So you want for them to feel positive about it, and it's important for them to be able to acknowledge an issue or problem that the child is experiencing. And it needs to be valid to the parents. So presenting problems by talking about depression, psychological adjustment, or unhappiness won't gain the support of the parents. They will think, my child's fine, they need to toughen up, whatever. And so in a specific case in this study, the therapist knew that academic achievement was of utmost importance to this family, probably through the intake process or whatever it was. And the therapist phrased the issues in terms of how to remove the obstacles that are impeding on the academic progress. So it was not saying, your child has all these issues, we need to fix them. It was, I see some obstacles in there that are impeding on their academic progress. So let's fix those so that we can get them with good grades and things like that. And that made the parents think, oh yes, that's exactly what we look for in the future. Let's do that. And this allowed for reframing and common ground to be made with the parents. Careful structuring is really important for the therapist. Figuring out the roles and relationships, like we talked about, who to talk to and in what order. It's always important to know who the boss is of the family. Oops, I keep doing that. Oh my goodness, how do I go backwards? Here we go. Sorry. And so we want to know who we're allowed to talk to, what we're allowed to talk about, in what order, things like that. We need to empathize by gaining knowledge about their cultural experience. And so asking questions about where they come from, what their beliefs are, in a respectful manner, and then normalizing the problem to help diminish guilt and shame, which are two huge things in Asian American culture. Okay, I think this is funny. So cultural brokering is huge. It's the presentation of the parents' and child's cultural viewpoint, which involves the parents' roles, the child's behavior and experiences in school, the parents' experiences, concerns, and anxieties in a new society, the patterns of role relationships in the family, and the pressures of the outside demands on the child and the parents. So this allows the family to scapegoat the acculturation process, basically blaming acculturation or moving to a new country or this and that. Let's blame it all on that. That's why you're having your issues, but we still need to solve them. Okay, so some clinical interventions and prevention for Asian American children and families. They have a lot of treatments, and I'll go over some of them specific to Asian Americans. So, treatment of diagnosed mental disorders or psychological problems, the integrative model, transcultural framework, and object relations based therapy. These are all things that have in the past been used and proved to work on Asian American children with current mental disorders or psychological problems. But then there are prevention models that include primary prevention-based group intervention with adolescent Vietnamese refugees. That's a really long intervention or model. And enhancing Asian American parenting. The PGIAR, I can't even say the acronym, PGIAR targets adjustment difficulties and or psychological disturbances related to refugee and resettlement experiences. I messed that sentence up, but I'm about to go into it in the next slide. Okay, yes, so the PPBGIAVR, whatever, targets adjustment difficulties for refugee and resettlement experiences with children. This is delivered in a group format typically, but it can be given individually. The goal is to prevent psychological maladjustment, and the specific objective is to promote skills that will facilitate appropriate and assertive interaction and enhance social skills. Y'all, I'm so bad at this. Okay. Enhancing Asian American parenting is another prevention method or intervention. It integrates cultural and developmental perspectives that can help Asian American parents fulfill their parenting responsibilities in a multicultural society. This prevention program addresses parental concerns about child behavior and or development. It is made for parents of children who are symptom-free or very young, whose behavior is of concern to the parents. Can also be used, though, with parents of older children in therapy or with children in need of therapy. It can be delivered individually, conjoint, or in group. But I think typically it's in group. Maybe not. I might have read that wrong. So goals include facilitating acquisition of parenting concepts, skill learning for both the parents and the child, behaviors that will enhance the parent-child relationship, which is big, and foster developmental outcomes conducive to successful adaptation in a multicultural society. Woo. Okay. So promoting cultural competence in counseling Asian American children and adolescents. This goes back to the model minority, and it's important for clinicians to know about, I think, just so that they are already ready to expect the pressure that the children already feel, and then they're feeling it on top of at home, at school, because everyone thinks they're so smart. They must be because they're Asian American. So some cognitive barriers for these children include that some Asian Americans do not distinguish between psychological and physical illnesses, which makes me laugh a little bit because, I don't know, I think it's just, it's funny. They don't go to a counselor for mental problems for their child because they see it as a physical illness. So then they go to their physician, and maybe their physician refers them out, but maybe they don't. I don't know. And so it's not as typical for Asian Americans to be seen in a counseling setting. They adopt avoidance and problem minimization. So it's typical for them to avoid and minimize the issues. They tend to see mental illness as mediated by willpower and the avoidance of morbid thoughts. It leads them to believe that psychological help-seeking behavior is unnecessary and inappropriate means for solving personal difficulties. Then there's affective barriers. They're reluctant to report problems and seek professional help because of shame and stigma associated with having psychological issues. Um, Seeking mental help is usually their last resort because of their base culture or pienza. Okay, so this is their value orientation barriers. So this kind of compares Asian cultures to Western cultures, us. And so Asian cultures are very collective in that they care more about their long line of family and not embarrassing them and what would they think. And it's not about me, it's about my family line. Whereas in America, we think about ourselves and not as much about our family line. We want to do better than our family and things like that. Asian cultures believe in having duties and obligations, whereas to their family, whereas we believe more personal rights and privileges. It's all about me. And Asian cultures value hierarchy and status within their family. The man being the most important. You know, if they don't, it's crazy because the tests that they take, if they don't do well on those tests, it's like you're gone. You're in the workforce. You don't get to have a chance at going to university or whatever. But in America, you know, we believe in equality and egalitarianism. I hope I said that right. Asian cultures value deference and respect. You know, you should always respect your elders in the Asian culture. And these are important things to know for counselors, I think, just because it is so different from us. And I think that we still value respect of people that are older than us, but it's important to know how important it is to Asian cultures. Um, and in Western cultures, we kind of encourage assertiveness. You know, go out and get what you want. Don't hold anything back. Asian cultures have self-control and restraint, whereas we encourage emotional expressiveness. And so in Asian cultures, it's like, no, hold it under your shell. Don't let it out. Hide it in the closet. Whereas in America, we're like, let it be you. And then there's obvious communication barriers. Even though they learn English, a lot of the times some words just don't like come across the same. Small example that's not really relevant, but I think it's cute. I have a little girl that I teach who is 6, and every time I ask her a question that she doesn't know, she says, I didn't know. And I can't bring myself to correct her because it's so cute. And, you know, she's supposed to be saying, I don't know. But just little words like that. In other cultures, you know, we think it means one thing. One letter A has 5 different, you know, apostrophe or whatever it is over the top of it in China, and they all sound different. So, and, you know, learning different languages, you might not always be saying what you think you're saying. Okay, so I'm not going to read all of these, but here are some awesome, really good tips that I picked up about, and I put the reference at the bottom. But I do want to go over a few of these. So this first one, when counseling Asian American children and adolescents, explore some common difficulties involving parent-child conflicts caused by different levels of acculturation. So I think that's important because if parents are extremely inculturated, I think was the word, where they don't want to adopt this new culture, whereas their kids are in school with other children every day and they do want to, this is going to cause issues in the home. And so it's important to sit down with the parents and children separately and say, what do you believe? And find things out like that from the get-go. Seeking help from older generations is really good, I think, just so that you can kind of learn about the other culture. You know, nobody's going to be able to tell it better than firsthand knowledge of someone who is living that. Let's see, which one? Oh, what other one did I want to talk about? Number 7, I think, was kind of important. Don't view their um, their strong values and their you know, saving face and all that as interdependence or enmeshment or um, as their way of trying to be different. It's important, I think, to see them for who they are and try to understand them and let them know that. I personally think that Dr. Yule might be able to elaborate on this more, but I think as a counselor it's important to say that I'm aware that I'm a white woman and I might not know all of the things about your culture, but I sure want to, and I want to understand and be able to help you. And I think that when you tell someone, I want to help, it's not that I do understand, but I want to understand, that you can go a lot farther with clients. And then here are my references. Yay! I hope all of this recorded correctly, or I'm going to be mad if I have to start it over. So thank you all for watching me talk about Asian American children, and I hope you have a really wonderful rest of your summer. See you soon, hopefully.